How to take care during pregnancy. Feeding. Many young people are concerned by the appearance of your body and fear of weight gain during pregnancy. But this is not the time to cut calories or go on a diet because you are feeding two people. Both you and your baby need certain nutrients for the baby to grow properly. If you eat a variety of healthy foods, drink enough water and you reduce the junk food, high fat, help to both you and the baby are healthy and growing. Doctors generally recommend adding about 300 calories a day to the diet, so as to provide the baby with adequate nutrition growth. According to the weight you had before becoming pregnant, you should gain between 11 and 15 kilos, 25 to 35 pounds, during pregnancy, mostly during the last 6 months. Your doctor will advise you about this depending on your particular situation. Eat more fiber from -25 to 30 grams daily, and drinking enough water can help prevent common problems such as constipation. Fruits and vegetables and whole grain breads, cereals or whole wheat muffins are good sources of fiber. It is necessary that you avoid some foods and beverages during pregnancy, such as some types of fish such as swordfish, canned tuna and other fish that may have a high content of mercury. Your doctor can help you decide which fish to eat. Foods containing raw eggs, such as mousse or salad type Caesar. Raw meat, fish or just cooked. Processed meats such as sausages or cold cuts. Unpasteurized soft cheeses such as feta, brie, blue or goat, and milk, unpasteurized juice or cider. It is also desirable to limit the consumption of artificial sweeteners and caffeine and artificial sweeteners. Exercise. Exercising during pregnancy is good for your health when you have no complications with the pregnancy and choose appropriate activities. Doctors generally recommend low-impact activities such as walking, swimming and yoga. In general, you should avoid contact sports and high-impact aerobic activities that pose a higher risk of injury. It is also not recommended to do a job that involves heavy lifting for women during pregnancy. Talk to your doctor if you have questions about what kind of exercises are safe for you and your baby. Sleep. It is important to get plenty of rest during pregnancy. During the first months of pregnancy, trying to acquire the habit of sleeping on your side. As pregnancy progresses, lying on your side, knees bent, will be the most comfortable position. It will facilitate the functioning of the heart, since the baby's weight will not exert any pressure on the vein that carries blood from the feet and legs back to the heart. Some doctors specifically recommend that pregnant girls should sleep on his left side. Because some of the major blood vessels are in the right side of the abdomen, lying on the left side helps keep the uterus puts pressure on them. Ask your doctor what your recommendation. In most cases, the trick is to lie on either side, to reduce pressure on the back. Throughout the pregnancy, but particularly in the later stages, it is likely that you wake up frequently at night to go to the bathroom. While it is important to drink plenty of water during pregnancy, try to drink more during the day instead of night. Go to the bathroom before bed. As the pregnancy progresses, you might be hard to find a comfortable position in bed. You can try placing pillows around and under the stomach, back or legs to feel more comfortable. Stress can also affect sleep. Perhaps you're concerned about the health of the baby, birth, or how it will play this new role of mother. All these feelings are normal, but can produce insomnia. Talk to your doctor if you have trouble sleeping during pregnancy. Emotional health. It is common for pregnant adolescents experience a variety of emotions such as fear, anger, guilt, confusion and sadness. Maybe you take some time to adjust to the fact that you are having a baby. It means a huge change, and it is natural for pregnant teens wonder if they are ready for the responsibilities involved in becoming mothers. The feelings of a young often depend on how much support received by the baby's father, his family, and family of the baby's father, and his friends. The situation of each youth is different. Depending on your situation, you may need to seek more support for people who are not part of your family. It is important to talk with people who can support you, guide you, and help you share and sort out your feelings. Your school counselor or nurse can guide you to find the resources offered to help your community. In some cases, teenage pregnancies and spontaneous abortions have lost the baby. This can be very sad and difficult to overcome for some, but to others it causes a feeling of relief. It is important to talk about these feelings and receive support from friends and family. If this is not possible, go to counselors or teachers. The school and the future. Some girls plan to raise her baby by themselves. Sometimes grandparents or other family members help them. Some young people choose to deliver her baby for adoption. These difficult decisions involve a great deal of courage and concern for the baby. Young women who have completed high school will have greater chances of getting a good job and enjoy a more successful life. As far as possible, you should finish high school now instead of trying to go back to school later. Ask your school counselor or a trusted adult that you provide information about what programs and classes offered in the community for pregnant teens. Some communities have support groups especially devoted to teen parents. In some schools, no child care. Perhaps a member of your family or a friend can take the baby while you're at school. You can learn more about what happens when you mother if you read books, attend classes, or consultations. Reliable websites on parenting. Your pediatrician, your parents, your family members, and other adults can guide you when you're pregnant and when you become a mother.